Hi, I'm Kendrick. I'm a respiratory therapist student, and today we're going to be going over trach care. Alright, so the first thing that I'm going to do when I come to the room, well, I'm going to check the chart, check the patient's orders. I'm going to also verify their name, date of birth on the wristband, make sure I have the correct patient, and then I'm going to come over and gather all of my equipment. Here, as you can see, I have a suction catheter, I have a tracheostomy care kit, I have a drain sponge, I have gauze, I have some hydrogen peroxide, and then over here I have the sterile water, and I have some smaller ones right here, some Q-tips, tracheostomy tube holder, and then I have some replaceable inner cannulas, and I have some containers over here to hold my fluid. Alright, so now I'm going to get into it. First thing I'm going to do is I've already washed my hands, sanitized, got into my gloves. I'm going to go ahead and double glove up for this one.
Stop contaminating me.
You are.
Okay, okay, so let's go back. Where's my mind? Oh, we suction the patient already.
Alright, and then prior to doing anything, I'm gonna go ahead and hyperoxygenate the patient.
Once I deflate the cuff, I'll get it to the patient that getting time to estimate. So when I treat the cuff,
Alright.
make sure you have your
Alright, so now I'm going to go ahead and check the breath sounds of the patient.
connect because you're not going to be able to do it with your
I'm going to check breath sounds. I've already begun hyperoxygenating, and I already went over suctioning the patient right after. Alright, so I've been hyperoxygenating the patient after suctioning, and I'm going to go ahead and get started. So firstly what I'm going to do is move his oxygen over here a little bit, just enough for me to get to the cannula. Twist it, pops out like that easily, and I'm going to put it over here so it can soak while I'm doing everything else. Alright, so then I'm going to go ahead and take the drain sponge out of here, gently without moving too much. I'm going to throw this old one out. Then I'm going to take my gauze right here, a fresh piece of the gauze. I've already disposed some sterile water into here, and I'm just going to wet them a little bit. Once that's nice and wet, fold it up a couple times here, and drain that off excess water. And then what I'm going to do is come over here and I'm going to wipe, making sure not to wipe over the same spot so I'm not rubbing dirt around. Alright, so now I'm going to get some more fresh gauze, wet these up a little bit more. I'm going to do a little bit of a pull through technique where I'm going to take it, roll it up to like this, and then you go and you slide it under there with as much ease as possible. Carry it through to the other side. Pull through. I'm going to change gauze every time I'm doing this. Drain it. one up. Technique with the Q-tips just to pick up any other extra or residual dirt or anything that I can get to. So what I'm going to do is come here, start in the center, and roll outwards. So I'm not bringing anything back towards the center of the stomach. I'm changing the Q-tips every single time. Rolling outward. Down here at the bottom as well. Still rolling outward. So I'm going to go ahead and change the tracheostomy tube holder now. There's a little technique I personally like to do. So what I'm going to do is unlatch this side. Here. And I have to hold this the whole time I'm doing it. Strap this one. You just pull it through like that. Tighten it over here, and I'm gonna make sure it's not too tight to where typically I can get one finger in there, 2 finger depending on your hospital's guidelines, but we're going by 1 in this situation. All right, and that's back on. And lastly, I'm gonna clean the inner cannula. So I'm gonna go over here, get it. I have a little scrubber right here. Scrub in through the bottom area right there. Scrub in on the top. Get as deep as I can. Touch all the areas. Get all that gunk or whatever else is in there out. And then lastly, I'm going to use the sterile water to rinse it off. Because I don't want to put that hydrogen peroxide back inside. So rinse it off. Make sure everything's good. Make sure it's clean off. And then go back in. And this one, get it in that little area, and it clips back on. Once it's secure, all I have left to do is put a new drain sponge back in. Here we are. With the drain sponge, gonna be very careful. Try to slide it under like I did the gauze earlier without pulling the trach out. Just like that. And then the same on the other side. Again, being very careful not to pull the trach outward. And then place the oxygen back and return him back to his normal oxygenation settings. And that's going to be all for my trach care video.